Mosquitoes always bite you first? You bruise easily? Heart disease runs in your family? Your blood type might be part of the reason. There are 8 biological profiles, and each one shifts how your body handles stress, infection, and inflammation. Let's break down where you stand. O positive, the most widespread. About 37 to 38% of the global population has O positive blood. Type O red blood cells do not carry A or B antigens. That matters because antigens influence how blood interacts with the immune and clotting systems. Research shows that people with type O tend to have lower levels of von Willebrand factor, lower levels of clotting factor 8. This translates into slightly lower risk of blood clots, slightly lower risk of certain cardiovascular events. But there's a trade-off. Type O individuals are more prone to peptic ulcers, more susceptible to severe bleeding injuries. There's also evidence suggesting type O may have offered partial protection against severe malaria in certain regions, likely because the malaria parasite binds less effectively to O-type red blood cells. That's adaptation, not magic. O-negative, the universal donor. Only about 7% of people are O-negative. O-negative lacks A antigen, B antigen, and Rh factor. That's why it's used in emergency transfusions when doctors don't have time to test blood type. But here's the catch. O-negative individuals can only receive O-negative blood. From a transfusion standpoint, that makes supply critical. There's also the Rh factor issue during pregnancy. If an Rh-negative mother carries an Rh-positive baby, her immune system can react. Modern medicine prevents this with Rh immunoglobulin treatment. Today, it's manageable. Historically, it wasn't. A positive, higher clotting and different risk profile. A positive makes up roughly 30 to 34% of people worldwide. Type A carries A antigens, and studies consistently show higher average levels of clotting factors compared to type O. This means higher statistical risk of blood clots, slightly increased risk of stroke and heart disease. Some large population studies have also found associations between type A blood and higher rates of certain cancers, including pancreatic cancer. Important word, association, not cause. It likely relates to inflammation pathways influenced by blood group antigens. This isn't destiny, it's risk probability. A negative, same clot profile and added rarity. Around 6% of people have A negative blood. Physiologically, it shares the same clotting tendencies as A positive. The added factor is Rh negativity, which limits compatible donors and requires careful pregnancy management. From a health perspective, risk patterns are similar to A positive. The main difference is transfusion compatibility. B positive, distinct immune interactions. About 8 to 10% of people have B positive blood. Type B carries B antigens, which alter immune signaling pathways. Some research links B to higher susceptibility to certain autoimmune disorders and different responses to infectious disease exposure. However, the data is mixed. One consistent theme: blood type influences how the immune system identifies self versus foreign. That matters in inflammation and disease progression, but it does not define personality, diet preferences, or metabolism. Those claims are not strongly supported by modern evidence. B negative, rare and logistically complex. Less than 2% of people have B negative. Health tendencies mirror B positive, but transfusion compatibility is much more limited. In trauma medicine, rarity matters. From an immune standpoint, there's no proven superimmunity, but certain viruses and pathogens do interact differently with blood group antigens. Research in this area is ongoing. AB positive, the universal recipient. AB positive is found in about 3 to 4% of the population. It carries A antigens, B antigens, and Rh factor. That means AB positive individuals can receive blood from any type. But here's what large-scale studies have shown. AB blood types tend to have higher levels of clotting factors, increased risk of cardiovascular complications, higher statistical risk of cognitive decline later in life compared to type O. One major study, the REGARD study, found a correlation between AB blood type and increased risk of cognitive impairment. The likely mechanism, higher clotting factor levels affecting microvascular circulation in the brain. Again, risk increase, not certainty. AB negative, the rarest, less than 1% of the global population. AB negative individuals can receive blood only from negative donors, can donate plasma universally.
Because AB plasma lacks anti-A and anti-B antibodies, it's extremely valuable in trauma care. From a health standpoint, risk patterns resemble AB positive, mainly related to clotting tendencies. The main defining factor here is rarity. The bigger picture. Here's the truth. Blood type influences clotting chemistry, immune system signaling, susceptibility patterns to certain infections, but it does not define personality, diet preferences, guarantee disease, or predict lifespan. It shifts probabilities. That's it. You are not controlled by your blood type. You're influenced by it, alongside lifestyle, diet, physical activity, stress management, genetics beyond ABO, and environment. Blood type is one variable in a very large equation. If you know yours, drop it in the comments. But don't treat it like a horoscope. Treat it like data. And data only matters when you use it intelligently.